Yes, thank you. All right, so here we go. All right, ladies and gents, thank you for jumping into the stream and welcome to the first episode of a new journey. Yes, I know I said living with NMO and lupus, but I am going to cut it short because that's a mouthful to say. So we're going to stick with the new journey. This is the very new episode of it. And to not hold anything up, folks, I am going to introduce our special guest today. We have Kim Chiarella. Kim, did I pronounce that right? The last name?
You did.
Awesome. I'm educated.
Good job.
And Connor Cronan. Oh my gosh, I'm too excited now. I can't pronounce anything. So I'm going to introduce them. Kim is and I don't know if you know this, Kim, but I dubbed you my personal neuro patient educator. She is by way of the Alexon Pharmaceuticals. Connor is also my physical therapist, and he has a decoration of doctor of physical therapy, director of rehab and performance, as well as strength and conditioning specialist. So our topic today is going to be focused on neuromyelitis optica spectrum disorder, acronym NMO. And it's going to be a pretty interesting topic. It's all going to be focused on autoimmune conditions. This one, again, directing towards NMO. Um, and our focus today is really defining what neuromyelitis optica is, treatments and managements, how it can affect you in your daily life, meaning your workday, your lifestyle in total, your health and wellness. If you are involved in fitness at all, how that can be affected and how you can tailor that itself. Um, Looking or trying to diagnose your, well, not diagnose, but to recognize your own symptoms if they stay progressive and true in that way, or if any new symptoms manifest as you go along that new journey with NMO. And also, what am I missing? Diagnosis, how you diagnose NMO. Um, and I believe that I think there's some other things in there, but as we talk, we'll get to know these things as well. So I think I want to open this up with Kim. Let's start off with some education first. Kim, can you go along the basis of just describing what NMO is for the audience?
So, the type of NMO that I'm going to describe is anti anti-AQP4 positive um, NMOSD, which means that your body is producing these antibodies that are water channel antibodies. And what they're doing is they're going into certain parts of your brain and your spinal cord, and your immune system response going after those antibodies is creating damage that you're noticing as um, difficulty with your vision, blindness in some cases, all kinds of peripheral issues. You know, arm, leg. That's from the lesions on your spinal cord. It's it's a very rare disease, and it's often misdiagnosed as multiple sclerosis to begin with because they share a lot of the same symptoms. There are some differing symptoms along with that blood test that will confirm the diagnosis of NMOSD. That's pretty high level.
Yeah. Yeah. So to the audience, if you really want to for lack of a lighter term, dummy it down. So what Kim is saying, it's a very chronic inflammatory autoimmune condition, and it affects your your nervous system, meaning it affects the optical nerves of your eyes and your spinal cord. Um, and what it does is it breaks down the protective layer of your spinal cord, so the myelin sheath. So imagine you have wired headphones, and the surface level, the plastic level of those headphones is protecting the underlying wires of that. That's your spinal cord. So once those wires start breaking, those underlying wires, which is your spinal cord, get exposed. And that's where the damage comes in. Like everything outside of those the plastic covering affects the wires on the inside, which is your spinal cord. And bang, you start having issues either with your vision. Um, in my case, I deal with transverse myelitis. So anything below my waistline, it affects your legs there. So feeling, your vision, your balance, coordination, all these things under that is where, this is how this autoimmune can affect your body uh, moving forward. Um, can any of the symptoms, can we describe some of the symptoms? I know I just said a few of them, but can we go a little bit depth into what the symptoms can do and how it affects you daily?
Sure. So some of the symptoms of NMOSD that are shared with multiple sclerosis, I'm going to start there because they are very similar. So vision changes, muscle spasms, muscle weakness, numbness and tingling in your extremities, extreme fatigue. In severe cases, it could be paralysis, bowel dysfunction, blindness, pain. And then symptoms that are more specific to NMOSD and that are not shared are it involves the area of the brain called the area postrema, and that's persistent hiccups, severe nausea, and severe vomiting, like intractable hiccups. They just don't stop, intractable vomiting. So sometimes if you present with those symptoms, the doctors can hone in a little bit quicker, but the ultimate defining process is the blood test
Uh,
and MRIs. It shows the lesions on the spinal cord and on the optic nerve. And the lesions in NMOSD are different than the lesions in MS.
okay, great. And as far as treatments, so we've got the MRIs and blood tests. Other treatments, like how can we identify those, and how can it? What do I want to say? I want not how can it, but the pros and the cons of treatments, side effects and such.
So, because of the role that I have in the department that I work in, I can
Hmm.
really only speak to our treatment and our label.
Hmm.
But, the way that our treatment works is it's a targeted therapy. It's a complement inhibitor. And what it does is it stops that process in your body of complement, which is actually a part of your immune system.
Hmm.
It's the terminal end of your immune system. And when your body does what it's supposed to do and release um, it releases the complement system to go and attack those antibodies because the antibodies are foreign. That's what's
Hmm.
causing the damage. So complement inhibitors, such as Ultomiris, stop the complement process.
Mm, okay. Yeah, so as far as some of the triggers, I think the worst thing for me were the body spasms, the tonic body spasms. Those are the worst for me. Um I don't think I ever got this across to you, Kim. Myself and Connor, we spoke about it, but I actually had a really, and this was my first one. I was leaving a patient's home and the spasm hit me just before I got across the street. So literally, my body locked up and down I went in the street. And well, I think everybody knows when you spray roaches with that Raid and they just lock up. Literally, that was my body, and then it went down. I was a statue. Um, how long it lasted, I don't know. It might have seemed like an eternity, but that was the worst feeling ever. So it felt like my symptoms kind of gradually just came in to say, hey, this is what you're going to be dealing with, you know, this is what you're going to be dealing with. And also, when I was actually in the hospital, I think my symptoms got worse while I was in the hospital. So prior to being admitted, things felt somewhat normal. But in the hospital for that duration, that's when I figured out, hey, my legs are not working as they should. So I don't know if that's the thing, if you ever heard about that, getting worse in the hospital and then having a really good upstream. Is that familiar?
Well, not to me, because I usually talk to the patients, after they're discharged from the hospital and, before they're starting on therapy. So, but I think truly, like any disease, especially the rare ones, I think every patient and their journey is so different and their
Mhm.
symptoms can be presented as so different that it's hard to just say that, it's hard to generalize anything. The symptoms that I gave you are pretty much across the board. You could have one of them, you could have all of them.
Mhm.
So you know what I'm saying? It's hard to, generalize stuff like that.
Yeah, yeah. What about and Connor, you can also jump in on this too. So we always talk about stress and things like that. Um, what do you feel, Kim, are some of the stressors patients may have to navigate away from? Because I know it's a very obscure thing to do because we just don't know what may trigger you at points. I know at least for me, that's like the hardest question when anyone asks me, like, what, what stresses you out? What triggers you? And I'm like, I don't know. I'm always so upbeat. Like, I don't know how to identify with these stresses. So they always talk about environmental stressors, stress in itself. Like, how do you identify and how do you get around that? And again, Connor, you can jump in on that as well if need be. But yeah, it's such a open thing. And like we all know everyone's different. Like, how do you try to channel that for a patient?
Kim, do you want to go first and then I can follow up?
Sure. So one of the real, it's really funny because one of the biggest stressors outside of all of the symptoms and the symptom management that we talked about is the fact that NMO is very rare, and it's hard for patients, families, let alone friends and coworkers, to really understand what's going on. It's not like you have hypertension and everybody has high blood pressure. So what pill did they give you? This is completely different. Um, and I think that adds a lot of stress in addition to trying to navigate life with all of these symptoms that you're having, before you start on therapy. I think that's a big, huge portion of it. So the mental health part of it is equally as important to address as the physical part of it as well.
Right, right. Cool.
Yeah, just to follow that up, I think it's so important to just, we've talked about this before, Kareem, where you just find a good support system, focus on controlling the controllables, recognize there's some things that unfortunately you have no control over when it comes to this disease, but there's still plenty of other things that you can operate within your environment to, give yourself the best chance to succeed from not only a physical standpoint, but a mental standpoint as well.
Yeah. So we talk about the support systems, like how credible is a support system and what do you deem as a really, really good support system?
Yeah,
Connor,
no,
you want to take that? Yeah.
yeah, I can take a stab at that. Loaded question for sure.
I went to work on this, guys. Like, I really wanted to make this episode happen. I went to work.
Yeah, I think the biggest advice I give to a lot of my patients is that you don't always have to. I think one, we can talk about more of it from like a healthcare standpoint, and then we can go into the other like social determinants. But just from like the healthcare aspect, the biggest thing I try to relay over to a lot of my patients is the fact that if you don't jive with a doctor, you can go find a new one. If you're not clicking with your neurologist or primary care physician, there's so many doctors out there that it's really key that you do find one that you feel like is listening to you, taking your concerns and actually creating actionable steps. So I think that's like part one, is just finding like clinicians that give you that peace of mind that you're in good hands. And then two, for like the social piece, everybody's a little bit different. Again, just speaking towards your experience, you're such a social guy, you've been involved in the community, you have a very athletic background, I think that you are somebody that kind of craves that like social connection. You're extroverted. So having some outlet in which you can speak about your experiences, just like this podcast, I think is going to be key for you to, kind of maintain that normalcy within this kind of unknown period, basically. So that's kind of my shtick on that. Kim, you have anything to add?
No, and I agree. I like control the controllable. I really like that. Support systems are they're, it's very, very important. I like support groups. I think that it's very important, especially with a rare disease, to be around other patients that understand what you're saying, because even sometimes it's, like I said before, it's difficult for family and friends to even understand that. So being around other patients and getting your family involved with support groups is also very important. Isolation, in the fact that you have a rare disease that can be a pretty big stressor. So
Yeah, sure. Yeah. No, totally agree on that. Um, Lifestyle changes. Um, so we all know at this point, this particular autoimmune condition can actually change your life literally like that, right? So we spoke about the blindness, the paralysis. The tonic spasms, I guess, is pretty much controllable. But when you talk about blindness and paralysis and things like that, what sort of lifestyle changes well, it's a big lifestyle change, but what type of lifestyle changes do you think you would have to change, well, during this entire journey? Because I mean, it's a life inhibiting thing, right? So what type of lifestyle changes do you think one would have to make during the course of either a flare up or just everything in standard moving forward?
Connor, you want to go first on that one?
Sure. Yeah, I'll just kind of keep to my scope of our experiences together, Kareem, of
Mm-hmm.
the physical activity side of things. I mean, when we first met, we didn't know about this condition. Was presenting almost like an odd type of disc herniation with
Yeah.
neuropathy, things of this nature. It wasn't really super red flaggy right away. You weren't getting any like progressive symptoms, no polyneuropathy, things that would clue us into it being something more like autoimmune, but that
Mm-hmm.
obviously progressed over time. And so, we kind of started our journey together with you being like this triathlete, boxer, kind of jack of all trades when it comes to athleticism.
You mean the man of steel?
The man of steel. There we go. I love it. And slowly we've had to kind of roll with the punches, adapt. I think the biggest difference between from when we started to where we're at now is just adopting a more flexible approach, just being open-minded to how you're feeling in the moment, dictating our decision making. We treat your rehab plan now a lot like almost like a menu that you select from based on the day,
Mm-hmm.
versus in the past we'd have very rigid guidelines and structure because we wanted to really be tracking everything to the T. But obviously with something like this, you can't do that because each day, each week, each month can be so vastly different. So I think when it comes to this particular instance, just learning how to be flexible, being okay with the fact that what we're doing now has to be different than what we did in the past, and really trying to just strive for some type of new goal that kind of fits with wherever you are along the journey, and making sure that goal is like realistic and both parties agree that it's meaningful.
Mm-hmm. Yeah, so I'm going to double back on that kind of with the flexibility. So, ladies and gentlemen, audience, so let me take you down memory lane a year ago, how this thing started for me. So you kind of get the idea of the word of pivoting, I guess. So when my first encounter with this happened, I remember I was walking home one day and my left leg literally stopped moving. It just went from complete walk to a drag. And from the drag, it just became completely magneted to the ground. Like it just did not move. Um, Luckily, I was able to shake it off. I thought it was a nerve thing, and then was able to walk fine. Um, my symptoms also didn't mirror like a back-to-back thing. It was just kind of like a gradual, like month behind a month. So it took some time for things to happen because this condition, things happen very, very quick. Um, I don't know if that's a testament to my athleticism and whole physical stature. I don't know, but thankfully it didn't happen like that. So weeks, a month apart, my right leg had a different symptom, but it happened in the right leg. My right leg became locked up, very stiff. So you went from a full gait to just literally like a peg leg. Was able to shake that off and walked it off fine, but I remember keeping track of it, keeping mental notes. So if anything like that happened, it was just like, all right, something's completely off. At the time, I didn't think it was anything neuromuscular. I mean, neurologically important, but it turned out to be that. Um, so fast forwarding a bit because I don't want to give you too much of the medical inclinations. It just take up too much time. Um, when I reached out to Connor and I told him exactly what was happening, we had to rewire the entire script of what I was doing from cycling to running to boxing to everything. Um, and hence we begin that message of flexibility. Connor, you want to expound on what we actually went through or did to tailor the program to make sure that I was still very much active?
Yeah, speaking to more like recently.
It could be recent, it could be in the past, just from just knowing what I was actually dealing with.
Yeah, totally. So I would say there's really like two parts to keep it simple. I think kind of the first half of our journey when we were still trying to like piece together what was going on. We didn't have any formal diagnosis. The plan was very much rooted in just like solid strength and conditioning principles, using what I like to call the symptom behavior model to kind of guide decision makings, making sure nothing was really flaring up your symptoms. We were progressing appropriately. Kind of traditional strategies that have worked well. And then, you know, given the fact that you encountered a few flare ups along the way and subsequent losses in function after those flare ups, we've had to really kind of go back to the drawing board and shake things up. And more recently, what we've been primarily focusing on is just having different components of the plan. We have a component that works more on like cardiovascular fitness, trying to take advantage of those adaptations we can drive from there, angiogenesis, formation of new blood vessels. We know from like exercise standpoint on these autoimmune conditions, it does seem that there can be some like neuroprotective factors at play with exercise. So really just trying to capitalize on that to prevent the kind of progression of the disease the best we can, and then combining the cardiovascular portion with like a lifting portion to kind of develop more of those like anaerobic capacities. And then lastly, we do have a little bit of a balance piece, coordination piece with your particular presentation, just given the fact that, again, these lesions are in the spinal cord. It does seem to be that there's, certain nerve roots that are affected. You still have good proprioception, but you don't have good feeling. So just making sure we're including movements that are able to still maintain what you still have and where the lesion hasn't gone to. So that's really the biggest piece now is, our shift has gone a little bit away from like chasing medals and, purely based performance to more of like, okay, how can we keep what you got and how can we make what you still have better?
Absolutely. So, ladies and gents, what this portion of the conversation is saying is you don't have to stop doing what you're doing. Just tailor it a little bit and keep putting one foot in front of the other and keep on trucking. Um, Connor, let's do this. And Kim, you can chime in on this one as well. What about energy levels? Like, how are we uh, tailoring not just mine, but speak to that athletic community as well. How are we tailoring our energy levels before, during, and after the workouts?
Yeah, so I think it kind of goes back to what we were saying before about just like having that training menu so that on each given day you can kind of assess how you're feeling. And we've developed a kind of scheme that I think has worked really well up to this point of, you're going to hand select the movements that you best fit how you feel on the day. And I think that has been the kind of biggest factor in our success up to this point, is just to kind of have somebody in my lens who can kind of design the plan to drive the adaptations we want. And then also, to give yourself credit, Kareem, you have plenty of experience with movement. I have immense trust in you. So our kind of relationship is based around the fact that I know you are well versed in exercise. I know you are going to properly select what you can and can't do based on your own energy levels. I know I have a lot of faith in you to not, kind of overdo things, because you're very good at pulling back. And it wasn't always that way. That we had to go through a lot of trial and error to get you to this point. But we are in that kind of space now where it really just is kind of a system that we set up that allows you to adjust. And, I'm not really concerned with week to week changes. I care more about tracking the data over like the months, and if I'm seeing that you're able to get in enough work that I believe will drive an adaptation, I'm happy. And if I'm seeing that you're not, then I'm going to make a tweak to the plan so that we can hopefully get it closer to a more like optimal dosage.
Mm-hmm. Awesome. Let's go back to communication a little bit. How important, and I'm talking about the one-on-one, as far as coach and trainee, how important you think it is to communicate such a condition or any autoimmune condition to your coach or trainer, your therapist, just to make sure that the guidelines stay here, but they don't do this and they don't do this. How important you think that communication between coach and trainee is. And Kim, we can also double back on that question with you on your side of things as well.
Yeah, I think it's everything. Like the start of any kind of plan needs to have good expectation management on both sides. Like we need to be in agreement on not only what's possible, but also how you're going to get there and how that's going to look and how it's going to fit your kind of lifestyle. So, I mean, communication's everything, right? It's really the grounds for success. If you don't have the proper foundation that's built in expectation management, patient education on the, what we do know about the disease. To Kim's point, there's still a lot we don't know. It is a rare condition. There's still plenty more research that needs to be done on this. So how can we use the data that is available to kind of construct our thoughts and expectations for how we think this is going to go? And then, from there is really where you can expect to see good results. But if you don't have that foundation, then it's probably not going to go well.
And then from my side, managing using Ultomiris, it's always important, to Connor's point, treatment expectations. You set those right up front. As long as you know what to expect and when to expect it, very important out of the gate. And I always, every time I talk to a patient, I always make sure that I let the patients know that they need to keep their doctor in the loop. So if something's not feeling right or if something's feeling great, it's always important to keep the doctor and the healthcare team in the loop.
Absolutely. So you mentioned Ultramaris. Yes, ladies and gents, that is my treatment. That's what I'm on every 8 weeks. Can you talk to the community a little bit about how important it is to, keep up with the treatments? And a lot of people always want to know the side effects to it, the pros and the cons of this specific treatment. Can you talk to them a little bit about that?
Sure. So Ultomiris, like I said at the very beginning, is a complement inhibitor. So what it does is it acts on a certain part of your immune system. It keeps your proximal immune system intact, so you can still fight off colds, flus, viruses, things like that, works on the complement part of your immune system, which also, that part of your immune system not only causes the damage in NMOSD, anti-AQ4, AQP4 positive NMOSD.
Say that three
It,
times
I
fast.
know, anti-aquaporin 4. It's rolls right off your tongue, but it stops the damage that is occurring in that particular type of NMOSD, but it also leaves you more susceptible to encapsulated bacteria, the most serious of which is meningitis. So you need to get the meningitis vaccines and watch for those signs and symptoms of meningitis. But the great thing about NMO Ultomiris for this particular type of NMO is that our clinical trials showed that not one patient in our clinical trials had a relapse. You want to you don't want to have a relapse because relapses can be very bad. So that's the important part to know about that. What else did you want to know about that? Oh, side effects. It's a very well tolerated drug. The side effects are usually pretty minimal. And patients do very well. I mean, and the fact that it's every 8 weeks is also a big plus. And the infusions themselves last anywhere between 30 and 60 minutes, depending. It's a weight-based drug, so depending on how much you weigh. And then you get monitored for an hour afterwards. So not really a horribly long infusion itself, and a very well-tolerated drug with great clinical trial results. And just so you know, I am the patient educator. I'm not in sales, but patients do very well on this drug.
Patients do very well on this
There you
drug,
go.
ladies and gents.
And I can speak to that too. I've noticed big improvements in Kareem's function following those transfusions. So I can chime in here as well. I'm no way affiliated with the drug, but can speak towards the physical therapy side of improvement in function following.
Mm-hmm. Yeah, it's been a wild ride. Ladies and gents, like literally, when I say my brain still functions with running, but those signals are still not completely there. So testing myself running, folks, literally, I have 3 seconds before my legs look like spaghetti falling out of a plate. That's what I've been counting, but I've been working on it. Kind of have not sent you the video yet. Kim, I have not sent you the video yet, but the maybe 8 seconds of jogging in place, they're coming along. So I'll have to send that stuff to you. So yeah,
That's
I've
awesome.
also I've been working behind the scenes, Connor.
Yeah.
I've been working behind the scenes. What else do I have here? Did we talk about the symptoms? Kim, can you go through the symptoms again? And as you do that, I'll identify some of my symptoms and let the community know what these symptoms actually feel like.
Sure. So vision changes. It doesn't necessarily mean total blindness, although in some instances, it does mean total blindness. Vision changes can be something as subtle as, just not seeing right to all of a sudden I can't see colors. Muscle spasms and weakness, we talked about that. Muscle pain, numbness and tingling. Just fatigue that goes beyond just, well, I just went out and ran 3 miles, but now I'm tired. This is fatigue. Paralysis, bowel dysfunction, bladder dysfunction. And then again, that area postrema syndrome, that part of your brain, persistent hiccups, persistent and severe nausea and vomiting. So those are some of the symptoms, that are characteristic to both NMO and MS, but those are symptoms that the doctor would take into consideration to diagnose.
Yeah. So some of the symptoms I have, and I don't know, because I think I mentioned to you both, and community try to like envision this. So under my feet, like I regain a lot more feeling under my feet. Um, temperature, I can actually feel a lot better now. But under my feet still feel like walking uphill barefoot on cobblestone. And from time to time, those symptoms change. So there's times where my left foot will feel better, but my right foot feels like it's still cement, although it's fully functional. Like toes, I can bend, I can flex, I can move my ankle, but it feels like it's complete cement. So with some of these symptoms, ladies and gents, they may change from time to time. They may not just stay, you know, in that specific zone. They may change. And also sometimes on my legs, sometimes feels like it's like ants crawling up my legs. You know, you put some pants on, they're supposed to feel like denim jeans or sweatpants. No, in my case, it just feels like ants are just doing this, crawling up my leg. So again, your symptoms may change from time to time, but try to monitor them so they feel like they're uniform and not just changing drastically and sporadically all over the place. Um, what else do I have here? I went to town on this, but I also don't want to keep you guys for too long. Kim, is there any way during treatment, and how easy is it for patients to reach out to you during these times of treatments?
So that's kind of, there's two parts to that answer. So if you would like to give patients that have questions my name and my phone number, they can certainly call me, and I can talk to them, and just answer any of the questions that they have, and I'm very happy to do that. I get a lot of patients that way. If doctors have my PEM card, you probably have it. I'm not sure if you do, but I can talk to patients that way. Another way is if patients are enrolled in OneSource, which is Alexion's personalized patient support program, especially if their doctor has prescribed Ultomiris and they're getting ready to start on therapy. Usually the OneSource specialists will give them give me a referral to call them. Then I can call them. But if they're not enrolled, and if they have questions, I can talk to them. They just have to call me. And it's very easy. I mean, I can go into as much or as little detail about the disease itself, about Ultomiris treatment, and, all the kinds of stuff that we talked about today, I can talk to them about. So feel free to give out my name and my number to anybody that might have questions. You're very welcome.
I'll make sure I screen them first, though.
All right.
I'll make sure I do that. Connor, we talked about these energy systems to try to monitor the patient athlete client going through PT, for lack of a better term. How are we monitoring or keeping the program in check to make sure everything is going on an upward trajectory rather than just falling fast?
Yeah, totally. So, still applying some strength and conditioning based principles into the plan for you. Generally my style is more of stick with the same routine for a period of time, enough time to drive adaptations, but also enough time for you to, get accustomed to the movements, get good at doing the movements, things of that nature. So, there is a little bit of that ramp up period that's required before, I think it's appropriate to really start pushing. So still operating under some of those elements we used to use all the time for you before, the disease has progressed to where it is. And then really the biggest change is more just being very granular with like how we treat program to program. So when you're ready for some new stuff, kind of looking back at the data with a little bit finer lens, slowing down the progressions from maybe where you were at before, making it more subtle, challenging different planes of motion so that your body is, again, just capitalizing on the areas that still are functioning well. And I would say the biggest difference there is just it's still progressive. It's just not as progressive, and the progressions are a little bit more subtle than we used to have them be. But that does not mean that we're, keeping things the same throughout. There's still a very big change from, I remember when we connected after your hospital stint, man, what was that? All the way back in like last February or something. Correct me if I'm wrong there, but from where you were,
January 24th. Yeah.
yeah. So, I mean, when we started after
Yeah.
that point, you were in crutches, right? And now you just told me you're able to, jog in place for
Yeah.
8 seconds. So I do think that there's definitely being
Mhm.
some functional improvements being made. It's just not like it used to be when, we'd be ramping up running mileage or biking hundreds of miles a week, stuff like that.
Kim, you should have seen me. I was an animal. Oh my gosh. Connor, would you prefer, and I mean, you can use me or not, with the training style, would you prefer more consistency rather than hit or overload on strength?
It's always going to depend on the goal. Like, I think it really is based off the individual. Like, what are you looking for? And then the cool thing is, I kind of operate under just like general principles. So, in your condition, right? I want to look at what you're interested in and then what we know about like the neuroprotective factors of exercise and how can we blend those two together, right? So your plan might be look way different than somebody who's maybe more interested in like, just purely weightlifting, or somebody who's just interested in cardio. So I think it's really just going to depend on the individual, but in your case, you are more of that hybrid athlete style. So having elements of each, which I do think makes actually for a great recipe to just kind of maintain and, again, build upon your function.
Yeah. Ladies and gentlemen, I hate counting reps. It's such a boring thing to do. Give me as diverse program as possible. Oh my gosh. Kim, circling back to you. I mean, and I know this is a pure neurological question, but as far as this condition, and you can say pass or attempt to answer it, no problem. What percentage of this condition can you say someone is more likely to be
You know what?
normal
I
for
don't
the
know,
most
Connor,
part?
if it froze for you too, but you froze and all I heard was the normal part at the end. So I missed the whole question because
Gotcha.
you kind of lagged.
No, sorry. So
That's okay.
in what percentage dealing with this condition would you say a person is more able to become normal, just regain certain things um, as they once were?
So
I
that's a
know it's
tough
kind of a
question to
hard question
answer. It is.
because
And the hard part of my conversation that I have with patients who are considering Ultomiris is that Ultomiris is designed to prevent relapses because you don't want to get worse, but it's not designed for symptom improvement.
Mhm.
So I have to
Got it.
stick to our label and our clinical trials. I can't just give
Yeah.
you like what I guess or anything. But again, good conversation to always have with your doctor because they, probably know more a little bit about the background, maybe more off label than I do, but I have to stick with our label. I'm sorry, that sounded like a really general kind of answer, but
No, I think that's a really great point you made, though, Kim, where it's with something like this, you can't promise anything. It's going
Mhm.
to vary greatly. There's so many factors that go into recovery. So to be able to even put a percentage on something is really just doing a disservice because it's, again, so individualized. There's so many factors that go into play. Even how quick the disease is progressing can really influence recovery and things of that nature. So yeah, I think it was well said, Kim.
thank you.
Yeah. Yes, ladies and gents. I feel like it's, you know, to keep you on the upbeat, just be optimistic and perform your life as though nothing happened. You do know something happened, but project it as though like you're bulletproof. Go through the fire. Go through the fire and keep your head above water. So that's my best take on it for the actual community. Um, Ladies and gents, Kim, Connor, I think that might be it. Anything that you each want to add to the community just to have them, stay abreast with things? I don't know.
Yeah, I guess just to end on like a slightly more positive note, just because we can't guarantee success, it doesn't mean that you can't still improve in in the function do still have. So that is kind of a mindset shift I like to give patients in this scenario where, yes, there's certain things that may be off the table for us right now, but there's still plenty of things to work on. And those things that we work on, have a chance to improve as long as they're not being affected.
Mhm.
And make sure you have
Anything
that
on your end,
support.
Kim?
Yep, make
Yes.
sure you have that
Yeah.
support, the support of people that in your circle, family, friends. Um, just just having that support means a lot.
Yeah. Ladies and gents, I think I would wrap it up with the final words of encouragement and positivity and whatever else you feel that is going to help you. Life is life, and you can be the healthiest person in the world, eat the healthiest, everything. Things are going to happen. And when they do happen, make sure you're sitting in a dark room trying to grow. Take it on the chin. I think that is the best way of learning and relearning yourself and to actually grow through your obstacles, whatever that may be. It's already there. Don't dwell on it. Find your solutions and keep marching forward. And with that said and done, ladies and gents of the Neuromyelitis Optica Spectrum Syndrome NMO, this is the end of the first episode of New Journey. I trust and hope you guys liked it. You learned something from it, and we will see you again at some point. Kim, Connor, thank you for joining me on this first episode. It was great, and it has been great to see you all. And until next time, we bid thee adieu. Be well, folks.
Thank you for having me.
You're
Yeah, it was a
welcome.
pleasure.
Pleasure.
Thank you.
Take care.
Hold on one. Where's the stop button? Come on, come on. So the computer just okay, great.